Hi everyone, this is Yicheng Zhang, and today I want to walk through my thesis for this conference with you guys. And my paper is mainly focusing on the association of smoking and oral health based on the NHANES database. So here is the background of my paper. So the good news is that cigarette smoking rates have fallen significantly for both young and adults since 1965. However, between 2011 and 2019, the percentage for middle school students and high school students who are currently using e-cigarettes have increased dramatically. So if you take a look at the chart on the right, you can see that the current e-cigarettes use prevalence among never smokers keeps increasing from 2016 to 2018. And studies have indicated that e-cigarettes using among young never smokers will increase the likelihood of using combustible products after they can legally purchase them. So in this case, stronger association in participants who had no intention of smoking shows that the e-cigarette usage was more than just a sign for people who would have smoked regardless of e-cigarettes use. So if we don't pay enough attention on this issue, we might see another increase of smoking population in the near future. But this is definitely not something we want to see, right? So in our paper, in order to just help people keep in mind that we should stay away from smoking, we conducted a research focusing on the oral health situation and smoking behavior. So here are the general steps of methods we conducted in order to get the conclusion of our research. So we will use the NHANES database as we mentioned, and for NHANES database 2013 to 2018 cycle, the study population comprises of non-institutionalized community residents in the US, and using probability sampling, recruitment, and evaluation, we begin by cleaning and processing data, and then we will utilize the probability pie charts to get a general idea of what kind of data we're using here. And to get the final conclusion, we will use the multivariable logistic regression. As you can see in the sample selection flowchart on the right, sorry. So we will only use participants who are aged between 18 to 50, and we will not do any deletion and imputation of the missing data to keep the data integrity. And for this cycle, we will have 8,681 observations left after the data cleaning. And then we categorize an individual smoking situation into three classes: current smokers, never smokers, and never smokers. So by referring to the previous papers, we will use those covariants listed here in our research. So here is the pie chart we use to get a general sense of what kind of data we are using here. So as you can see, if we compare the left and the right graphs, we can see that among the current smokers, the rate of people with unqualified oral health has increased largely. And here again, but this time we only focus on the formal smokers of all the participants. And if we compare those two graphs, we can see that for people who quit smoking only more than 5 months, the rate of people with poor oral health will increase dramatically. And it seems like all of those four graphs are telling us there's some kind of association between smoking and oral health status. So here is the feature of study participants in our research. So we will use the normality test to ensure the continuous variable is normal. And if a variable is normally distributed, then it means the means and the standard deviation are presented here. Otherwise, its median and the interquartile range are displayed. The Mann-Whitney U-test is used to evaluate the non-normality distributed continuous variables using two samples in different general oral health status and smoker types. So if there are more than two samples, then we will use Kruskal-Wallis test. The chi-square test is used to compare the categorical variables, while the Bobberoni correction is used to compare within each group. The Fisher test is applied to test the categorical variables, have only two categories. And here we can see both smoker types and the time of quit smoking have a p-value less than 0.05 in its table respectively. So it's telling us that these two covariants will impact the oral health. So here we can see the forest plot and the call of the logistic regression. We get a screenshot from the R console. So by setting the smokers as a reference group here, the p-value in the multivariable analysis is less than 0.05. So we can conclude that the smoking status can affect the oral health significantly. And with a 95 percentage of confidence interval of the odds ratios for both former smokers and never smokers, they do not include one. So we can conclude that the smoking has a negative effect on the oral health. And again, this time we will focus on only former smokers, but we categorize them into three different classes with different lengths of time of quitting smoking. And by setting former smokers who quit smoking more than 5 months as reference groups, the p-values for former smokers who quit smoking more than 16 months, which is 5 years, is less than 0.05. So we can conclude that the time of quit smoking will change the oral health condition. And again, we have a 95% confidence interval of odds ratio, but that does not include one here. So we can say that the longer period of quitting smoking is correlated with reduced likelihood of poor oral health among former smokers. However, there is one thing worth to ponder here. That is, the former smokers who quit smoking 2 to 5 years does not display a clear differences with our reference group. So we might want to focus on find out a valid cutoff point for the length of time to quit smoking with different oral health conditions in our future studies. So here's the discussion of my paper. So this study can have a significant implication for public oral health since we successfully demonstrated a correlation between smoking and oral health issues. And our study explained that by comparing to current smokers, the never smokers and the former smoker will have a much lower risk of unqualified oral health conditions. And then the effective smoking cessation approaches have been shown necessary to reduce the likelihood of a bad oral health problem among smokers. And the combination of nicotine replace therapy, the NRT in short, and the Champix in conjunction with educational measures seem to be the most effective techniques. And we need more recent meta-analysis of smoking cessation approaches based on the tobacco industry's recent development. So the electric cigarette is actually be treated as a possible alternative choice to quit smoking by the UK government. However, many studies indicated that the performance of using e-cigarette as a tobacco cessation treatment could be very limited. So again, we need more study to determine if e-cigarette could be a potential acceptable alternative to the traditional tobacco cessation therapy. And this issue might be focused on the future research studies. And for strong mental health support and society can help the smokers open to oral health diagnosis. So in order to help the successful smoking cessation, the improve of the treatment efficiency is definitely necessary as well. So in this case, if we can have increased performance of government institution to the smoking cessation, and we want to enhance the oral health condition of smokers, then it means that we need to train skilled dentists with a substantial salary offers so that they can have enough patients to treat every patient come to them. And then The majority, since you can see that by referring to the odds ratios and the confidence interval with different income and the different levels of education, we can see that the majority of smokers are economically disadvantaged, and only a small percentage of them seek to quit smoking. These smokers are more price sensitive, and as a result, they are less likely to cover the insurance of a cessation therapy and may view quitting smoking as a voluntary. So in this case, individuals with high incomes and education levels will probably want to raise the affordability of public oral health responsibility in order to minimize the disparities for disadvantaged population. And then, according to the US Surgeon General's report in 2014, the tobacco industry supported the prevalence of smoking by misleading the public about the hazards of smoking cigarettes via advertising and promotional activities. So, in order to preserve the optimal public oral health, the government should increase the intervention in the tobacco sector so that they can keep away every potential individuals who might smoking in the future to stay away from smoking. So this is our conclusion for this research. The oral health condition was demonstrated as associated with smoking status among the US population. And our study actually showed that the former smokers and never smoker will have a lower risk of unqualified oral health condition. And in the meantime, the duration of quitting smoking have an impact on individuals' dental health. The longer people stop smoking, the less likelihood the individual will have a poor oral health. So here is a reference of our research. And thank you all for listening to my presentation. And I wish you all can enjoy the conference. Have a good one, guys.